Viral replication. Viral replication is the formation of biological viruses during the infection process in the target host cells, since viruses cannot replicate on their own. Replication can only begin when the viruses enter or infect the cells. Viruses are classified based on their genome structure. Based on this, viruses can be RNA viruses, which contain RNA as their genetic material, DNA viruses, which contain DNA as their genetic material, and retroviruses, which have a single-stranded RNA gene, but in general are not considered as RNA viruses since they use DNA intermediates to replicate. The replication of RNA viruses is direct, which happens in the cytoplasm of the cell. The RNA viruses need virion enzyme or the viral RNA polymerase to synthesize messenger RNA or the mRNA, and their viral RNA serves as the mRNA. Next, the replication of DNA viruses is indirect, which happens in the nucleus of the cell, and the viral DNA is transcribed to host mRNA by host cell RNA polymerase. Lastly, the retroviruses, in which their replication is somehow unique, in the sense that they make a copy of DNA from viral RNA with the help of reverse transcriptase. The DNA is incorporated into host genome mRNA viral proteins. The release of viral DNA genome into the nucleus of the host cell initiates the transcription of mRNA. This viral mRNA serves both for the translation of viral proteins and as template for replicating viral genome. And so, as the virus replicates, thus increasing their number, there are also effects induced on the host. In most cases of acute viral diseases, the appearance of symptoms indicates the peak of viral replication. Viral replication inhibitors are developed primarily to prevent the formation of new viruses. Most of antiviral drugs are nucleic acids analogs, or structurally similar to naturally occurring DNA and RNA. Thus, they interfere with the regulation and the viral nucleic acid synthesis of either DNA or RNA. This prevents the initial process of viral replication. Drugs may also affect in specific steps, such as viral attachment to the host cells, penetration and uncoating of virus in host cells, reverse transcription, and virus assembly and maturation. Development of effective vaccines is still the most general approach in controlling viral diseases. In cases when vaccines are ineffective, chemotherapy is the only alternative measure. The main objective of antiviral chemotherapy is to eradicate the virus with little or no damage to the host and to prevent further viral infection. Only a few antiviral drugs have been developed which are considered safe and effective against some viral diseases. Most of antiviral drugs are developed for human use. Only a few are studied for animals. Antiviral drugs induce greater effect against fewer infectious particles and shows less efficacy in symptomatic diseases. Consequently, antiviral drugs or chemoprophylactic agents should be administered early in the incubation period.